Thank you for Ash for the invitation to present our abstract on COVID-19 at a Sickle Cell Center here in Atlanta. So our presentation is titled COVID-19 Infection and Outcomes at a Comprehensive Sickle Cell Center. The Grady Comprehensive Sickle Cell Center is the largest adult sickle cell center in the United States and has the first 24/7 acute care unit for management of sickle cell vaso-occlusive events. In 2019, the center provided 3,077 sickle cell outpatient visits and 3,695 acute care visits. When the COVID-19 pandemic reached the US, the center had a precipitous drop in the number of both outpatient clinic and acute care visits as state regulations for lockdown were passed. This report follows all the COVID-19 cases at a single adult sickle cell center in 1 year's time. The clinical database has been tracking COVID-19 patients, and out of a total of 1,343 patients, 55 patients contracted COVID and were tracked in the database between March 1st, 2020 and March 1st, 2021. 55 patients with COVID-19, 28 were female, 27 were male, 64% of the patients were SS, 31% were with SC disease, and 5% were with S beta plus thalassemia. 35% of the patients were on hydroxyurea for disease modification, the majority of them being with SS genotype. 31% had fetal hemoglobin determined as elevated, being above 5% by hemoglobin electrophoresis, and 47% of the patients had chronic pain with medium morphine equivalents at 90 milligrams daily. In the results, the rate of emergency department visits or hospitalizations for the sickle cell patients with COVID-19 was 80%. 49% of the sickle cell patients' visits was related to a vaso-occlusive event. 27% was related to COVID-19 primarily, and 20% of the patients had no emergency visit or did not require any hospitalization. And on the right-hand figure, you can see how the different sections of these patients were divided. Out of the number who were admitted to the hospital, which was 58%, we had 18% admitted for pneumonia, 36% admitted for the sickle cell vaso-occlusive event, and 4% admitted for another reason. And out of the total emergency visits, number of patients with only emergency visits, 22%, we had 13% for sickle cell VOC and 9% for symptom management. The COVID-19 signs and symptoms experienced by the patients were as follows. 58% had pain as the main presenting symptom, followed by cough and fever in 40%, dyspnea in 31%, and pneumonia with chest X-ray evidence in 25%. 2 patients developed acute respiratory distress syndrome and were intubated, and 2 patients died. 29% of the patients had lung findings on imaging, and 16 out of the 55 patients required treatment with the use of remdesivir in 9, dexamethasone in 8, and red cell products in 7. And at the time this study was being conducted, initially the patients who contracted COVID-19 had no access to directed therapies against the virus, but later during the course, that was more utilized. In the discussion section, our center experience was different from what was reported in other publications regarding patients who had contracted COVID-19, as 16 out of the 55 patients did require treatment, and 2 of those 16 died. The deaths occurred early in the course of the pandemic in June and July of 2020, when the total cases were diagnosed. Between March and September 2020, we had no additional, we had the 2 initial deaths. But the remaining 35 cases registered 0 deaths between October 2020 and March 2021, with the rate of complicated COVID-19 hospitalizations decreasing with better treatment available, as you can see here on the right-hand side. During the initial peak, we have noted a decrease in the number of clinic and acute care visits respectively. This was anticipated given the statewide lockdown that was implemented. To circumvent that, the center adopted virtual visits to deliver healthcare needs. This measure has aided in protecting our patients against contracting COVID-19. It is interesting that despite the second peak in the winter of 2021, there were no reported deaths among the patients who developed the COVID-19 infection. This finding can suggest that despite the concern for morbidity and mortality in the sickle cell patient population, The patient's diligence and awareness to stay home during the pandemic has proven crucial in reducing morbidity and mortality in this vulnerable population. And the option of having virtual visits for healthcare delivery was key and should be utilized further in sickle cell care. Thank you. Thank you for our patience and the team supporting us.